Hi, everyone. We're already so excited to talk.
I know, we're so excited to talk today.
I know. Everyone, I'm Dr. Diana Bitner, and here from True Women's Health, joined by my partner, Dr. Egan.
Hello, everyone. For those who don't know us, I'm the internal medicine doctor at our practice, and I also focus a lot on metabolic health and weight management.
And I was sitting here before we went live thinking about, we founded True Women's Health because we want to help women live their truth. And one reason that this came up is we just see that alcohol can become such a cloudy influence that it can really cloud women's ability to live their truth. And so that's why we think this topic is so important. And having, I think, both our perspectives is really important. And we talk about this a lot in the office. So we want to bring it to you.
Yeah. And, I think from my point of view, of course, like we think about it from a health perspective, but even within my own peer group, there's a lot of pressure in the mommy world to sort of drink, and it kind of gets brushed under the rug and accepted as it's something that you should do all the time. And it's kind of the ability to handle your emotions, instead of being a little overwhelmed with your kids, you can have some mommy juice, wink, wink. And I think that along the lines of providing women the truth, right? It's just here, we're just here to provide some information about how, alcohol can affect your body.
And how to enjoy it safely, right? We talk about limiting our treats. And so we think about how, if alcohol is something that you enjoy, I really like the taste of a nice red wine or a sip of a bourbon occasionally. But again, how much is too much? How does it affect our health? And I hear from a lot of women that they might not even want to drink at a social event, but they feel a lot of pressure. They feel like it's the only sort of, I hate to say bad, but bad habit that we have to apologize for not doing.
Mm-hmm. 100%. And as always, if anyone has questions, we love this to be a free space to sort of ask us questions so that we can pause and answer anything that comes up pops into your head.
100%. And if this is after the fact that you're watching this when it's not live, please feel free to private message us, and we will definitely get back to you. And we always like to start these events out with talking about, again, why does this matter to us? And I think a lot about picture of self. I think a lot about us having goals for ourselves and how we want to age, how we want to be when we're 50 or 60 or 70 or 90. Mm-hmm. And so thinking about our habits and our medical conditions in terms of what we're doing to get to that point. And so tonight we're going to talk about how does alcohol impact that? And we want to, again, provide you information to help drive your choices.
All right. And to get started, I think it can be really helpful to even understand the definition of what is an actual alcoholic drink. So when we talk about standard size for alcoholic drink, it varies on what the actual drink is. So, for a lot of our women that we see, wine tends to be a big alcohol of choice. So, 5 ounces of wine is considered one drink. And sometimes those glasses can feel like there's always a joke, you can almost like a whole bottle of wine in one of the glasses that are available now. And the other sort of main choice that people talk about is, just pure alcohol, maybe in a mixed drink, something like a gin and tonic or an old fashioned. And one drink includes 1.5 ounces of approximately 80 proof alcohol. So that'd be, gin, vodka, whiskey, something along those lines. When we're thinking about beer or something like a White Claw, obviously the alcohol volume per beer, which can change drastically on what sort of brand you buy, but a standard beer is about 5% alcohol volume, and that's about 12 to 8 ounces that we see as being considered to be one drink. So I think it can be important to sort of think about, even before we go into a social situation, kind of ballpark, what am I going to have and what is that going to look like? And even counting in your own head of how many drinks that would be.
Exactly. And so I think we think about like what is considered. So Celia, when you think about like mild use, moderate use, excessive use, how do you define that?
I think it depends on people's overall goals and the timing. So one of the things that's really started plaguing alcohol use in women was the concept of binge drinking, and that's the definition of greater than 3 drinks within 1 to 2 hours. And so if you're in a setting where you're consuming greater than 3 glasses of wine within an hour, that would be considered binge drinking, which can have different sort of health consequences than just having a standard number of drinks over a week per se, such as like 1 glass of wine every day over a week.
Sure. And I think about, and we'll get into this more in organ systems, but thinking about different risk factors. So I always think about breast cancer risk. More than 3 drinks a week does increase the risk of breast cancer, but more than 7, it's like a hockey stick. The risk just goes up really quickly.
Yeah.
So I'm sure it's like that.
Sometimes it can be really hard to, I love the definition of 7, because I feel like that's just so very clear cut of saying, 1 drink per day, or, more numbers per day, but in a smaller setting. I think it gets really complicated when we start talking about other organ systems, because the numbers tend to vary. The research sort of varies and bounces around. So I think the number of 7 drinks per week or greater than 3 drinks in a setting tends to be kind of the limit of what we're going to talk about.
And I think too, I see a lot of times just sort of standard guidelines for a woman, 1 drink a day. For a guy, maybe 2 drinks a day can be okay without the same effect, which I think that leads us into, how does alcohol affect women different than men?
Yeah. And I think one thing just to remember, that fortunately or unfortunately, alcohol affects women just by volume different. So women tend to have more body fat than men. Therefore, the alcohol stays in their bloodstream longer. It doesn't get absorbed into our fat tissue. So by volume, the same glass of wine is going to stay in, the same amount of alcohol per glass of wine would stay in a woman's bloodstream longer, sort of going to their different tissues, than it would a man. Whether we like it or not, unfortunately, that tends to be, what we see.
And that's not a reason to just lift more weights, right, and get more muscle mass so you can tolerate more alcohol. So,
although we harp on all the benefits of strength training, that's not one of them.
It's not one of them, right? We shouldn't be doing that. So what other gender-specific difference have you seen from the literature?
Yeah, I think the other thing that's sort of surprising is just the overall increases of ED visits, hospital stays, and deaths from alcohol-related health consequences have really drastically risen in women. And the alcohol use disorder, which is just basically the inability to, make a good choice around alcohol, has also increased more in women than men. So this really is a problem of our gender, and something that, all of us should think about for ourselves and for our family members and loved ones.
Exactly. And is the effect mainly on the liver in terms of increased risk of death at a younger age?
No, I mean, I think it's multifactorial, right? And I know we're going to kind of review the different body systems, but I think that it affects women in a variety of different ways. So of course there's the acute risk, right? Drinking alcohol while driving, your judgment goes down, you're more likely to have some sort of injury, right? Your balance goes off, you're going to have a fall. So all those different things come into play. Of course, if you're binge drinking, there is a risk of death from just alcohol overuse. That is a possibility, particularly if you're someone who doesn't have a lot of body mass and you're consuming at a rate, to a male counterpart. Your risk of having severe acute alcohol intoxicity would be really high. So just even from the simplistic side of things, we've seen those rates go up.
Sure. So that's just so scary. And even thinking about things you normally wouldn't do, like loss of judgment, having intercourse with someone you normally wouldn't want to do that with, or unintended pregnancies, and or getting into certain social situations. And I think that's one interesting thing that we found, the paper that you gave me today on social cognition. I was fascinated by that, how that's different in women than men.
Yeah. And I think even just the risk of, you're saying we're talking about social situations for some of our younger patients and even some of our, older patients, it's just even putting yourself in a little bit more of a risky situation where, you just don't know particularly what's going to happen. So it can always just be helpful to sort of think about that in terms of, volume of alcohol that we're consuming and being a real risk that could change your life.
Sure. So do we want to look at different aspects of organs?
Yeah, let's kind of look at that. Sorry for anyone who thinks, we love organs, so here they are.
So I think it's a good way to stay really, really organized. What one do you want to take first?
I don't know.
If you have any questions, please feel free to join the conversation or share some thoughts about alcohol or anything you might have heard out there in terms of risk factors or benefits.
So one of the things that I hear a lot in my sort of our practice when we talk about picture yourself is preventing dementia, which is sort of the progressive decline in our cognitive function. And it should be noted that alcohol use increases women's risk of dementia more so than it does for men, which is really frustrating. And in addition to just losing some cognitive function, which is just your ability to have logic thought and store memories, specifically alcohol targets the back part of your brain that develops like speech and balance. And over time, people who are chronic alcohol users really lose that function, which can put you at high risk for falls and just overall just decreases your like ability to enjoy yourself, be able to walk and increase your exercise tolerance and be social. So that's something that can be really helpful to think about.
I also think about all the other risk factors for dementia, like cardiovascular risk factors, high cholesterol, obesity, diabetes, and people who have alcohol overuse syndrome or tend to drink too much. They're not spending that time on exercise, for example. They're maybe not making really good food choices. So I think it can also have just a downhill effect on other.
Yeah, 100%.
Exactly. Do you want to talk about the heart and high blood pressure?
Yeah. So, in addition to, thinking about the vasculature of the brain, your heart also does not respond well. The actual heart muscle tissue itself, and then the blood vessel walls, the tissue that makes up the blood vessel walls. And, what we can see over time is that there's higher risk of having different, what we call cardiomyopathies, which means just the squeezing function of the heart doesn't work as properly. And then in addition, women are at higher risk of having higher blood pressure, which just can lead to, again, increased risk of having coronary artery disease, which is heart attacks and strokes. So on two fronts, alcohol really isn't great for your heart. I think for a while there, we kind of had the message that, that like drink of red wine a day was a good idea. There's been a lot of back and forth data about that over the past, I would say 5 years. And I think the party line now is really no amount of alcohol is particularly good for your heart.
Exactly. And I think was the thought that it affects and lowers the blood pressure and maybe, the tannins or the antioxidant properties. But again, I think it just sounds like the risk is much more than the maybe potential small benefit.
Yeah. And I mean, it gets into a little bit of controlling our volume of alcohol. And if you're someone that, sometimes that half a glass of wine kind of turns into 2 or 3, and then we've already crossed the barrier of just being too much alcohol per setting. So it may be sort of a volume related issue, but if you're someone who's maybe struggling keeping it to that half a glass of wine, then maybe no glass of wine every day would be a good choice.
Exactly. Well, and of course, as you know, I love to talk about sexual health, and a lot of patients will talk about their low libido, their inability to have arousal or to be able to, get in the mood at the time that it works for your partner, for everybody. And so alcohol can really inhibit this. This is one of the cards on the sex deck. It just really pertains to not only brain function, but also actual sexual function. So chronic alcohol use can increase the risk of just poor arousal, inability to have an orgasm, and just over time can even, I saw an article that shows it can decrease your testosterone. I'm not sure the route of that, but we do know it's a significant effect on women's sexual drive, just like perhaps on men.
And, we don't have we sort of skipped over the brain, but in terms of even hot flashes and some menopause symptoms, what have you seen in terms of alcohol and the changes of those symptoms?
Sure. So we know that hot flashes can definitely be triggered by just pure alcohol, just the effect of the alcohol on the thermostat in the brain, but also it's the sugar as well. So we know that when not only just from the alcohol, but maybe what's in the drink, a mixed drink with a lot of sugar, we know that the high blood sugar can trigger a hot flash. Just a patient recently who's taking estrogen, she's like, do I need more estrogen because I'm starting to get more hot flashes? So we looked back at what she was doing over the last week, and she wasn't drinking as much water. She had company in town, so she had a couple of extra glasses of wine one night, 2 or 3 glasses of wine, not drinking her water, and every night had terrible night sweats. And we really could relate it to her change in her habits. And so that would be something she'd be able to see quickly resolve. So alcohol can definitely increase the risk of hot flashes.
Which I think is just something that's really not discussed.
100% agree.
In so many primary care offices.
Right. And again, hot flashes aren't just something you can write a prescription for with estrogen and treat. It's looking at all of the extra triggers, including extra weight that can happen because of alcohol.
Mm-hmm.
Again, blood sugar fluctuations habits. We know we'll get into sleep, but maybe you become more sleepy after you drink alcohol, but then as it wears off, you wake up. We know that your sleep will not be as good quality the rest of the night after alcohol. And so that first awakening can trigger a night sweat, and then the mind gets going, and then the rest of the night it's night sweats and fitful sleep. And so it can really start to affect quality of life, ability to be present during the day, to focus, to concentrate, all that stuff that we need to do.
Yeah. And that, it just leads to feeling quite frustrated.
Yes. And again, you might start out with good plans for the day, but then get into a certain social situation. So, if nothing else, we really want you all to think about, like, how am I going to make a plan for my week, for my day, for a certain event?
Yeah, 100%. Kind of moving on to some of the different organs. We think about lung infections, which would be something like a pneumonia or a respiratory virus that just causes everything from, being quite seriously ill to that chronic little cough and tickle that just drives us nuts. Too much alcohol can really affect our immune system's ability to sort of function. It kind of goofs around with our cells' ability to get to where they need to be and fight off any virus or bacteria that's there. In general, as if you drink more alcohol, particularly if you're sleeping, your body's natural ability to, what we say, protect your airway or the tubing that goes down to your lungs sort of declines. So it's that combination of you're kind of inhaling a little bit more extra stuff, whether it be food or just your own sort of secretions in your mouth, and then your immune system sort of not up to the task, and you just are higher risk for getting sort of lung infections, which again can be anywhere from pretty serious to a pneumonia to just that annoying sort of tickle that we just no one wants to deal with.
And again, I think about all this stuff as we talk about it. Who wants any of these consequences? But again, in the moment, it can be hard to make that decision. So we want to empower you to really think about how do you want to be?
Yeah. Kind of moving on to the next topic. Even your stomach. So obviously alcohol before your mouth, your esophagus, and then down into your stomach it goes. Alcohol can sometimes cause increase of gastritis, and in general can just cause like an upset stomach, and it can sometimes change your GI flora, which can lead to a whole bundle of changes, as we've talked about in the past. The big thing I see in sort of my practice when we're talking about weight is just sort of, that extra weight around your belly. I will fully admit, I don't think I've had one person come in and say, God, I love this extra pooch that's here. Dr. Egan, please don't lose that, right?
Yes,
I cannot say that I've heard that. And that tends to be the target area that a lot of women talk about. When we're talking about, aside from the liver damage itself, but even how our body handles food, the first pass through all the food that we consume, which includes alcohol, is through our liver. And the interactions of all the different things that we eat really change then how our liver processes that. So the link I'm sort of getting at is if you have a drink that has a lot of sugar, the first thing your liver is going to process is the alcohol, which puts the sugar processing on a bit of a back burner, which tends to put the body into more of a weight gaining state because it's not able to process some of that sugar. So sometimes we'll see higher or lower blood, just basically sugar fluctuations. They'll either go too high or too low as the liver sort of processing that alcohol. So, even though it may not be a high sugar content by volume, it's because it's mixed with that combination of alcohol that can really cause a lot of problems.
Yeah, a lot of patients will say, okay, am I okay if I just drink, let's say, vodka or tequila that's low sugar, like by itself with some soda, or, what is it, the skinny girl margarita or skinny girl, cocktails. But again, it's not only that it's not that it's just low sugar, it's the alcohol effect. And then, of course, how do you think about the cravings that happen afterwards with loss of inhibition?
Yeah. And, it's making a good food choice is hard, right? There's a reason. Most of us know kind of what to eat when we're feeling healthy. And we know that we shouldn't have half of the charcuterie board, right, in the moment. But when you're there and you're having a glass of wine, it just makes it even harder to sort of make those good food choices, which overall pushes us further away from our overall kind of weight and health goals.
Yes, our picture of self.
Yeah.
Talk about the liver. I think that's kind of common understanding that alcohol affects the liver, but how does it affect the liver?
Yeah. So, believe it or not, actually the end stage result of a sort of scarred liver is something called cirrhosis, which means that your liver is no longer able to provide all the functions that it does, which it does in a lot of amazing things, from processing to hormone creation to biofeedback to the rest of our organs. It really is quite an amazing organ. Over time, if you are feeding it high levels of alcohol or ethanol that we consume, right, the liver cells will get damaged and your own immune system comes in to take care of those damaged cells, but will leave a little bit of scar tissue in place. And every once in a while, probably over a lifetime, it wouldn't drastically change the function. But you can imagine if that was happening day in and day out, that replacement of those liver cells with scar tissue would cause a big problem. The kicker to this is everyone's a little bit different, right? So you always hear these stories, oh, my grandmother drank a glass of scotch every day and she lived into her 90s. And so it's totally fine. And, that may have been true for your grandmother, but it may be different for you. And so it's very difficult to know exactly how much alcohol your liver can take. We kind of use this number of 1 drink a day and, less than 3 drinks per setting is sort of the goal of keeping our liver healthy, but that still, we don't know for sure if that's actually accurate. In addition, if your liver is struggling a little bit with what we call fatty liver disease. So what that means is the foods that we've eaten basically have triggered our liver to store fat in and around the liver cells. If you add on, which is also causing an inflammatory process, so that if you add on top of that alcohol use on top of that fatty liver disease, you're just creating a lot of scar tissue and can rapidly progress basically cirrhosis. Basically the risk of cirrhosis is higher in women than in men, which can kind of feel quite scary. So it's something that we should just think about. And it does feel like one of those things like, oh, it's just never going to be me. But sadly, we do see this, out in the world.
And I'm sure in your training in large hospital systems, you saw a lot of pancreatitis. I know when I was a resident or a med student in Detroit, it was a common issue.
Yeah. So your pancreas is there to secrete some digestive juices into your small intestine to help kind of digest all the food that you're having. So a large volume of alcohol can cause something called pancreatitis, which again is just sort of this inflamed state of an organ. It's extremely painful. Over time, if you have these chronic episodes of inflammation, again, that organ will be replaced with scar tissue and then it stops functioning, which can cause a tremendous amount of problems sort of later in life. So your pancreas is definitely something that you want to keep intact and is a real risk for just too many alcohol drinks per setting and then kind of chronic inflammation from too much alcohol over time.
I agree. And I see we've got intestinal issues. How do you think about alcohol in the intestine? Definitely the bacteria and the biome, but anything else?
We didn't even touch on this topic, but we do see a lot of intestinal GI cancers that are at increased risk, with drinking alcohol, specifically esophageal, colon, mouth and throat, which are never pleasant cancers to have, but, there are real risks with increased risk of alcohol.
And back to maybe even just, again, that guideline, 3 a week, it starts to increase risk and more than 7 really increases it.
Yeah.
So I also think about the bones, which we don't have here. We know that excessive alcohol can lead to increased risk of osteopenia, which means thinner bone or poorer bone with higher risk of fracture and the risk of osteoporosis. So I know I'll have patients who will have their first bone density at menopause right around 50, 52, and will be often quite upset, like, oh my gosh, I've got this, osteopenia. I've got a higher risk of hip fracture, of elbow fracture, of wrist fracture if I fall, and not having thought about vitamin D, but also the effect of the alcohol. So again, it's just thinking alcohol can affect our bone health and needs to be looked at.
Yeah. And I mean, the fact of the matter is alcohol is a toxin, right? And your body will respond to said toxin by making different changes. And it's not something to be, it can feel hard to find sort of that balance, but if it's happening more and more frequently over time, you can imagine that your body's going to respond with some negative health consequences.
Exactly. I want to talk about anxiety for a minute. A lot of patients will drink alcohol because their mind is racing and they feel like it settles them down, or they're really stressed. So I'm just going to have a glass of wine and I'm going to relax. Mm-hmm. I think it's almost, one of those things that maybe in the moment it helps, but then it makes everything worse. You want to talk about that, like decreasing the ability to process?
Yeah. So if you think about the different parts of your brain that are sort of balancing out, the logic, the happiness where we feel contentment versus kind of the survival side, fight or flight, the rumination that we're having. What alcohol does is it doesn't what we hope for during the day, right, is that we have more of that contentment, and we have the social support and all these other things, exercise, meditation, healthy eating, all those things that provide that contentment for our brain structure to feel, a little bit more empowered. When we're feeling anxious, a lot of times that flips. So we're living the state of a little bit more of a fight or flight. We can't get a handle on some of our thought processes. Alcohol doesn't help with that flip back. All it does is just quiet that noise down. And honestly, at the end, it honestly makes it more. So then now we're struggling even with more anxious thoughts, more sort of fight or flight, and we're almost in a worse situation than we were before. So, when we're thinking about drinking alcohol and where we're at in terms of our alcohol use, if it's a situation where you feel like it's enhancing your current setting, right? I'm with a partner, we're out to dinner, right? This feels like I'm getting a better meal with this glass of wine, then maybe that's an okay thing. If you're alone and you're feeling anxious and you feel like you have no support system, then maybe turning to alcohol in that moment maybe isn't a good choice.
And potentially can make everything worse.
100%. Yeah.
So again, yeah, we get it. And saying all this, at True, we often talk about there's no shame, right? There's no shame in having made a poor decision or have gotten into a bad habit. I had a patient today. It's like, is it too late? Like, have I messed up for too long? I'm like, no, like there's lots of time and we're good. But it's just being able to have this discussion is not an ethical discussion per se. People fall into habits in certain places. Like, we just want to help people have information again to get out of these situations and to be able to, again, to reach your goal.
Yeah. And I always tell my patients, pick your poison. We all have these vices that we rely on when we're not feeling well. Some people it's sugar, some people it's alcohol, some people it's, gambling, porn, anger, gossip, right? There's so many different things out there that that our brain goes to when we're not feeling well. What I think we hope to do in a completely non-judgmental way is I think all of us should just ask this question: what's my relationship like with alcohol? Right? Is this something that that needs help or needs to be adjusted? Right? And it can be a fair conversation to have with your primary care doctor or any provider that's taking care of you.
And I think it's like good to talk about how you talk about habits with food, with alcohol. If it's something that you can't get off your mind, you become obsessed with, that can be a real issue versus is it a choice of boy, I'd like a treat. What would I like versus I can't get this off my mind.
Mm-hmm.
And that might be a time when it's time to really have a think about this.
Yeah. So I think we have 5 take-home tips. Okay. Number 1, know what makes up a standard drink. I think we all should basically have a backbone knowledge of information of how many drinks we're having per setting. It's hard to know what 7 drinks are if you don't even know what one is. So, kind of take a look at some of our graphics that we had and kind of in your own mind, sort of think about how much. I've done this more with water just so I can think about what does 80 ounces of water look like, but it can be helpful just be like, I'm going to measure out 12 ounces. What does 1 glass of wine look like? There's no shame in sort of educating yourself.
Exactly. And number 2, alcohol affects women different than men. Again, I'm fascinated by the effect on social cognition. Again, being able to judge certain situations, making decisions in certain, but again, I think we've talked about the effect on women different than men for organ systems and for overall health.
Yeah. The big things that that to just drive home, alcohol affects women more than men, just from being higher levels in your bloodstream, higher rates of dementia, higher rates of cirrhosis, higher rates of, the rates are increasing with, hospital stays. So it is something that we need to think about as women.
And again, risk of breast cancer. I have patients who say, I had no idea that alcohol affected my risk of breast cancer. And so, boy, that's a choice I wish I would have made, or that's a choice that now I can make going forward, is if nothing else, I don't want to have more than 7 a week because I do not want breast cancer.
Yeah. So number 3, know your risk for alcohol-related diseases. So as we were just talking about, if you're someone who already is at higher risk for breast cancer, it can be maybe you'll make a different choice about how many alcoholic drinks you want a week. I think we do a pretty good job with talking about cancer risk, and we always will provide more resources. So I think getting as much information about your different risks, whether it be heart disease, liver disease, dementia,
colon cancer,
we're always there to sort of help review those risks with you. And you should be proactive in finding your own, of asking those questions of either our office or whoever you're seeing as a doctor.
Exactly. And when, if you're a patient of True, you'll know that we go through 9 different areas of wellness. And so we're always thinking about what are all your risk factors in these 9 areas, so we can make sure that, again, you're able to reach your health goal. So that leads us into, what is your picture of self? So I think it's so important that we all just take some time to think about, what is our picture of self? How do we picture ourselves at a certain event, at a certain time? I have some women who say, well, I don't think of things that way. Like, my brain doesn't work like that. I just want to live each day. So then I would think about, how do you feel on your best day? People talk all the time about, I want to be healthy. Of course, then I push them to define, what does that mean? Usually it means I feel energetic, I feel motivated, I feel like engaging, I'm doing things I normally like to do, I'm cooking dinner, I'm being social. What does that feel like? I can go run a 5K. I can. Celia, how do you talk about this or think about this?
Yeah, I mean, I think, a lot of women will talk about where they don't want to be. I think that is a big thing that, people will say, my dad has diabetes, I don't want diabetes. My grandmother had dementia, I do not want dementia, right? And so it can be helpful to use some of that to say, okay, where are you at now? And if you don't want to be there, how can, maybe your picture self is not having diabetes and having and optimizing your blood sugars as much as we possibly can.
Right. And then I like to always take that and flip it. So you don't want diabetes. So what does it look like if you don't have diabetes? Oh, you're free of medicines. You're free of going to the doctor all the time. You're free of being tired, of having sugar cravings, of having a higher risk of worrying about a heart attack. So really always flip it to that positive, and then have clear intention. Like, what do I want?
Yeah. When we talk about cravings, I mean, the fact of the matter is, cravings are uncomfortable, and it can totally feel appropriate to say, I just don't want to have cravings anymore, right? These cravings, women to talk about cravings consuming their thoughts, and that feels bad. And it's okay to say, I don't care anything about diabetes or heart risk or cancer. I just don't want to have the burden of these cravings anymore. And maybe that's something with you and alcohol. It's okay to say, I need a better relationship with alcohol. And maybe it doesn't mean you're going to be sober for the rest of your life, but I need to develop a better relationship here because it's uncomfortable and it burdens me and it makes me feel distressed. And that's an okay place to be.
Yeah, I remember I had a patient years ago who, it was my first time to sort of think about this, but she said, I'm fine until about 3 o'clock, but then something clicks in me and I cannot get it off my mind. Like, help me. What do I do?
Yeah. And that's a fearful, anxiety ridden place. And I don't think even in the medicine world, that we've basically been empathetic to the fact of how uncomfortable that feels. And it just can be okay to have that conversation with one of your doctors and seek out help if you're just struggling with cravings.
100% agree. And what's number 5? I like this one.
Know when to take a break. So again, if maybe your relationship you're kind of realizing maybe your relationship with alcohol is not where you want it to be, it can be okay to take a break, even though it feels not okay from maybe a partner, family members, friends, right? And feel empowered that if you need a break, that maybe that's the best thing for you.
And again, so many people will talk about, even, hey, we go down to Florida in the winter and, oh my God, everyone's drinking all the time. If you don't go to happy hour, you're shamed. If you don't,
happy hour starts at 1 or noon.
Yeah, exactly. So it's like, what do I do? How do I face that? So, it's okay to take a break. Maybe there are certain people you don't hang out with as much, or you only see them once a week, or you have your glass of club soda as you walk into the party, and you say, I'm all set. Like, it's just having that plan in place and not having shame about it.
Yeah. And know that some of the feelings that maybe you're having when people are maybe eliciting a response from you, most of the time is just you holding up a mirror to them and their reaction about themselves, right? And that's what ends up happening a lot of the time when people give you a bit of pushback. It's more of just that you're maybe kind of showing them that taking a break maybe is a good idea, and maybe they're uncomfortable with that.
Yeah, like they wish they could, or they wish they didn't have that second glass of wine. They're feeling guilty about it. So of course, then they're going to give you a hard time, because how are you capable of not having a drink when I can't seem to be capable of not having a drink?
Yeah. And this can definitely be a hard conversation to have if that person that's, causing you a lot of stress is your partner. Right. And that can be a good, time to maybe get some professional help to talk that out with if a partner is really causing you some distress, because that can be a lot of discomfort in a home, and that's frustrating and it's hard.
It's really hard. And I think it's having a plan. So Carrie, I love what you say. I feel so much better having a mocktail. Exactly. And it's just making that quick decision, right? To have like a club soda with some lime. I have this phony Negroni, it's the bitter that makes, what's the name of the drink again? The
Negroni?
Italian. Yeah.
Oh, the
Negroni.
Aperol Spritz? Yeah.
Yeah. Aperol Spritz. So it tastes, just a little bitter and with a little club soda. And then, afterwards, when everybody else is leaving the party, they're like, oh, I don't feel so hot. And you're leaving the party saying, hey, let's go do something else, right?
Yeah. Well, definitely the next morning you're feeling better.
Exactly. Definitely.
Yeah. My favorite drink of choice is this drink, company called Recess. I'm a sugar fiend. I always look at the sugar content of everything. So this is my favorite one just because it has very low sugar associated with it. It also has some adaptogens in it, which sometimes can make people feel a little bit more calm. And I think it's perfect. Comes in a can, if you're at the beach or something, I think it's a great choice instead of having just, the next beer or the next cocktail.
Right. Well, I think back to when I was pregnant, each of the 3 times, like, club soda with a lime was my go-to, and it's just will always be even that, just club soda at a get together, or even club soda and just a little bit of wine, just to have that taste, to have that glass. A lot of couples will say, or a lot of women will say, I go home and I just want to have a glass of wine with my husband. Then we might have another one. Like it's the ceremony, right? It's I deserve
100%.
it. So again, maybe just have a little bit of wine and then some spritzer, or a teeny little bit of just a splash of vodka or whatever it is.
Yeah. It's amazing how even just putting a non-alcoholic beverage, like we love our kombucha too, right? Even in a wine glass. And there's so much that is with that hand to mouth movement, right? A beverage in a cold glass with a hand to mouth that can feel so comforting. I mean, our brain is really tricky that it relies on a lot of these pathways and actions to provide us the contentment, but sometimes it doesn't even really know what it wants. I mean, I talk a lot about my patients with eating, right? And so even just that hand to mouth, like sometimes our brain's just like, whew, I'm feeling better. And it's not necessarily the alcohol that you really needed. You just needed some time to relax, and you got home from work and you just want to talk to your partner and you just want to chill. And that's okay to do the hand to mouth in a wine glass with, a non-alcoholic drink. Exactly. Carrie also suggested Spindrift, which is good. That's a good one too.
And I love bubbly. That's my other favorite go-to. So we all have our favorites, right, Carrie?
Yeah.
So let's get into some questions. We love to give you some questions to, if you don't get to see us at True, like what can you go and ask your primary care doc about, or your women's health doc? And so question number 1, am I drinking too much alcohol? Again, to be able to ask this question and just talk it out loud. We talk a lot about that. Can we just be in a safe space, talk about what I'm doing? I need to say this out loud and hear it and have some support.
Yeah. And again, just knowing, what a standard drink is and kind of doing a bit of a count for 1 week would be really helpful.
Exactly. I love how you say that. Just add it up once, or, and just get a sense. So it's right there. You can't manage if you don't measure, right?
Yeah. 100%. Number 2, what is my risk for alcohol-related diseases? Again, we want to continue to empower women to be their own advocates for their own health. And, your doctor should be able to give you a fair understanding of where your health risks are for, heart disease, cancer, diabetes, osteoporosis, just so you know kind of where you're starting from.
Perfect. And number 3, I love this because, again, we want you to have takeaway tips that as this gets you thinking about your relationship with alcohol, what are the resources?
Yeah. So again, a lot of women, us all standing here sort of using the logical part of our brains, we get it, right? I get my 7 drinks and I understand that. But again, 3 p.m. kicks in, 5 p.m. kicks in. All of a sudden we're starting to feel a little anxious, and we do tend to turn to whether it's sugar, alcohol, one of those other things that we use for our own emotional support. Sometimes those aren't the right answers. And maybe it's finding the right therapist, the right group to sort of help with some of your coping mechanisms that aren't driven by, alcohol, sugar, or one of these other things.
Well, I think too, we were talking, there's a couple different apps, and there's one app that you were mentioning. Do you want to talk about
Yeah,
again?
there's one that's sort of the psychiatry world's really taken this on, and there's a couple of different apps out there. We really like the app Reframe, which can help you sort and count sort of how much alcohol you're using. They have a quiz to help you guide you about whether or not you're drinking too much alcohol, and then some other support systems to sort of help guide you through the next steps. Again, not drinking alcohol or making that choice can feel really uncomfortable, and in a completely non-judgmental way, it's okay to have some extra help around this topic. Sometimes
Exactly.
apps can be nice just because they're, a quiet way for you to personally kind of review some of this information.
Right, because I'll have lots of patients who say, I don't want to go public with this. I don't want to go to AA. I don't want to label. I don't need that. I want some help, again, just adjusting my relationship. And I think this is a really nice, safe way to do that.
Yeah. The mainstay of, alcohol treatment has really been AA, which is Alcoholics Anonymous. I've had a lot of women patients that swear by AA, and that is their thing and their jam. It's across the country, which is nice. And there tends to be meetings at all hours of the day and at a lot of different locations. AA, we've heard, feedback from women that it's tend to be geared a lot towards men. That's why some of these other sort of structures have been put into place. And it's okay if you've gone to AA before to say, I just didn't fit in. That's not where I found my people. And, that's okay to say that. And there's a lot of other, resources that are now geared towards women that can be really helpful.
Super important. Question number 4. I want you to be able to say to your doctor, again, to be empowered to say, can we have a bias-free discussion? I think sometimes it depends on how comfortable the doctor or the healthcare provider is talking about alcohol. Maybe they have their own challenges in their family. Maybe there's some other issue that they might have. But it's really important to ask, can we have a bias-free discussion? Can we talk about this as a condition, as a situation? And hey, if you can't talk about this, if this is something you know about, who would you recommend I talk to?
Yeah. I remember I was talking to some of my family members, and we were talking about going to the doctor, and they were saying how they go, oh, the primary care, when you tell the doctor how much alcohol you drink, the primary doctor always just doubles it. So then I cut mine in half. And I'm like, you guys are not at the right doctor if you have this like back and forth of mistrust about alcohol consumption.
Exactly.
So it can be good just to ask, can we really get into the details of this? And because I'm worried and I care about my health, and I want to make sure that I'm doing myself right.
I love that. Exactly. And I think this kind of falls into, we were talking about the book. What is it called again?
Like a Woman.
Like a Woman.
Yeah. I think that book sort of got sprung from the fact that a lot of women were finding the resources available were not something that was calling to them. And it acknowledges that in our world, whether it's the mother world, the girlfriend world, that
menopause world,
the menopause world, a lot of these things are like just revolve around alcohol, and that, just kind of having that conversation about how, kind of unfair that setting up some moms and women to say that, like, if they're already struggling with cravings and it's just this constant message that that's where you should go, if you're having a problem, and to cope, that it can feel very confusing and frustrating. And so that's a great book if you're, ever interested in learning more about this topic, maybe for yourself or for a friend or a loved one.
Perfect. And number 5.
Can you tell me how alcohol is affecting me? What do you see?
So to me, this is thinking about just even number 1 metrics of health. It's like, what is my blood sugar? What is my belly fat? What is my body fat composition? And then looking at even depression scores or anxiety scores. I'm looking at how one makes choices with food, with social situations. It's really getting into that, developing a relationship with your doctor, so you can really have a good sense and be able to, again, talk this out loud.
Yeah. Even I think women will talk a lot about just stopping drinking alcohol. Just their skin looks different. They feel that they overall just kind of have a better look, better glow.
Yeah. I remember reading an article one place. It was like the things I noticed quickly when I stopped drinking alcohol. And it was about, oh my God, I slept better. I could fall asleep. I could stay asleep. I have less anxiety. My skin looks better, like you said. My hair is better. It's just overall, it's pretty amazing how much it can affect our health.
Yep. All right, Dr. Bitner, I think this was such a great topic.
Thank you.
Yeah. And as always, we always love to provide a non-judgmental place for women to come to learn about their health and learn how to advocate for themselves.
Yeah, so please share this with your friends and family. And again, let us know if you have any further questions or other topics that we can discuss. And we hope you stay safe and stay healthy and live your truth.
All right. Thanks, guys.
Thanks.